You've been prescribed trimethoprim sulfamethoxazole, a combination of trimethoprim and the sulfa antibiotic sulfamethoxazole. The mechanism of trimethoprim sulfamethoxazole affects folate synthesis in bacteria. Folate synthesis needs thymine. Both trimethoprim and sulfamethoxazole inhibit the production of folate, which is fundamental for making thymine for the DNA of bacteria. It does, to a mild degree, affect the thymine production, the folate production in humans, but much less so. In essence, when we use an antibiotic, we're creating biological warfare in our gut. Therefore, some bacteria is going to be killed off, other bacteria will thrive, and colonies will shift. Taking probiotics or reintroducing the healthy bacteria in the intestine as we're taking these antibiotics, and for the week after, can be very beneficial. Of concerns, bone marrow toxicity is one of the major concerns with the sulfa drugs. Hypersensitivity to the sulfa drugs, to sulfonamides, to trimethoprim, the other drug we're taking here, the sulfonylureas, the thiazides, and the loop diuretics will be reviewed. If you're allergic to any medication that is a sulfa drug, you should not be taking trimethoprim sulfamethoxazole. If you have a history of genetic or acquired porphyria, which is a disease that generally presents with neurological and skin problems, then you should not be taking this either. The diagnosis of porphyria is a rare disease and is usually picked up on history and physical with some labs. If you have severe kidney or liver problems, we probably won't be prescribing this. To some degree, kidney problems can be managed by lowering the dose. Folate deficiency states such as metformin use, where you have not reintroduced a supplement of folate. Metformin is used in diabetes frequently. Some anemias can be from folate deficiency. We don't want to worsen those. Sulfasalazine use, which is also a medication used for inflammatory bowel disease. And excessive alcohol use has a problem with both creating deficiency of folate and causing bone marrow problems. Pregnancy in general, this should be avoided, although midterm pregnancy, it's in theory quite acceptable. And infants that are up to 2 months old, or better 11 months from conception to account for prematures. And anyone with a particular concern for bone marrow toxicity, those individuals with deficiencies of either white cells or platelets or red blood cells. The sulfa moiety, or group that causes reactivity, is also found in drugs that are used, as I mentioned, in diabetes, the sulfonylureas, in diuretics that are used for hypertension and for fluid management, acetazolamide, which is used in altitude sickness, and some anticonvulsants, including acetazolamide, and these other famous drugs, Celebrex, which is celecoxib, and sumatriptan, which is Imitrex, Sotalol, which is used generally prescribed by the cardiologist for rhythm disturbances, and some others. This is a list of drugs that also, if you're allergic to, you should not be taking trimethoprim sulfamethoxazole. Sulfa drugs are effective particularly in urinary tract infection, particularly bladder. They're also used in sinus infections and bronchial infections that are thought to come from sinuses, toxoplasmosis, an infection that can be gotten from interacting with cats and cat scratches, and other infections including pneumocystis, pneumonia, and many other infections particularly. In conclusion, trimethoprim sulfamethoxazole contains a sulfa drug, so if you're allergic to any sulfa drugs, avoid it. We need a culture and sensitivity of your urine to ascertain that we got the right antibiotic. You should take the medicine as prescribed by the pharmacist, by the doctor, and the information by the pharmacist. Should pay attention to the pharmacist's recommendation, particularly about avoiding sunlight. I always recommend taking vitamin D3, either 200 or 2,500 international units until you know exactly what works for you. This is just a good chance to remind you of that. Significant side effects include a minor drug rash, which is not that uncommon, a more severe skin condition. There are two, Stevens-Johnson syndrome and toxic epidermal necrolysis. They are very rare, but they do occur. So any change in your skin status that seems out of normal, it's important to get in contact with us. Bone marrow toxicity, particularly if you're on the drug for some time, we need to consider even monitoring your white cell count and platelets to make sure that they're adequate. And immune hypersensitivity reactions, therefore things like anaphylaxis, just very severe reactions. If you react to other sulfa drugs particularly, that means avoid these. Asthma, and atopic dermatitis, and atopy, general inflammatory reactions, part of your immune system. And the bacteria also can become resistant to sulfa drugs, another reminder that the culture is essential. The course of antibiotics should be followed with use of probiotics for the week of the antibiotics and for the week after. Very good. Hope this helped. Thanks.